Welcome to The Growing Dentist by Dr. Ali. In this video, we will learn about salivary glands. The oral cavity is a moist environment, with a film of fluid constantly lining the tissues. Saliva is responsible for all the major functions of the oral cavity. Deficiency of saliva produces devastating effects on the mucosal lining and teeth. There are three pairs of major salivary glands: parotid, submandibular and sublingual. Multiple number of minor salivary glands are also present, which produce mixed secretions in the mouth. Functions of saliva include protection, buffering, digestion, taste, antimicrobial action, maintenance of tooth integrity, and tissue repair. Saliva is a lubricant. It protects against noxious stimuli, microbial toxins, minor trauma. Mechanical washing action flushes away bacterial, cellular debris and sugars. Calcium-binding proteins are present and they form salivary pellicle, which behaves as a protective membrane. Saliva acts as a buffer in two ways. First, many bacteria require a specific pH for maximal growth, thus protects colonization of specific bacteria in the mouth. Secondly, plaque microorganisms produce acid from sugars, which demineralizes enamel if not washed away. Negatively charged residues in salivary proteins acts as buffer. Also, salivary peptides seal and raises pH after exposure to fermentable carbohydrates. Saliva is important for digestion. It provides taste acuity. It also neutralizes esophageal contents by diluting gastric chyme, forming a bolus of food. Because of an enzyme called amylase present in it, there is a breakdown of starch. It enables pleasurable sensations of food to be experienced. It dissolves substances to be tasted, and contains a protein guston for the growth and development of taste buds. Saliva contains a spectrum of proteins with antibacterial properties. Lysozyme is an enzyme present in it, that can hydrolyze the cell walls of some bacteria. It also has lactoferrin, that binds free iron, and deprives bacteria of its essential element. Bleeding time of oral tissue is shorter than other body tissues. When saliva is mixed into blood, clotting time may be accelerated. Rate of wound contraction is greatly increased due to epidermal growth factors present in the saliva. Saliva is saturated with calcium and phosphate ions, which ensures that ionic exchange with the tooth surface directed towards the tooth. After the crown erupts, the final maturation takes place after interaction with saliva, with diffusion of ions onto the tooth surface. This increases surface hardness, decreases permeability and heightens resistance to caries. Let's discuss the anatomy of salivary glands. Parotid gland is the largest salivary gland. It is located in front of the ear and ramus of mandible. This gland is intimately associated with peripheral branches of the facial nerve. Its duct runs forward across the masseter muscle and can be palpated with the finger. At the anterior border of this muscle, the duct turns inwards, and opens in the oral cavity, opposite the second molar tooth. It weighs between 14 to 28 grams. Next in size is the submandibular gland. It is located at the posterior part of floor of mouth. This gland is tucked up against the medial aspect of the mandible. It has an excretory duct that runs forward and opens in the mouth, beneath the tongue, by way of a small orifice lateral to the lingual frenum. It weighs between 10 to 15 grams. Sublingual gland is the smallest of the major glands. It is situated in the floor of the mouth, between the side of the tongue and the teeth. Its secretions enter the oral cavity through series of small ducts opening into the sublingual fold. It weighs about 2 grams. Minor salivary glands are between 600 to 1000. They exist as small discrete masses throughout the oral cavity. They don't occur in the gingiva and anterior part of the hard palate. All of these glands have a mucus secretions, except for serous glands of von Ebner, which are present at the V-shaped groove on the tongue. A salivary gland arises as a focal thickening of the oral epithelium that grows in the underlying ectomesenchyme, to form a small bud, connected to the surface, by a trailing cord of epithelium. At the same time, ectomesenchymal cells condense around this bud, thus developing clefts, to form 2 or more new buds, producing successive generations. This ectomesenchymal cells are specific for gland development. The development of a lumen within this bud begins in the distal end leading towards the proximal end, and then finally in the central portion. Tubular luminization is completed throughout the tree before it reaches terminal buds. As the lumina develops in the terminal buds, further clefts enter a series of units 2 cells thick called terminal saccules or terminal end pieces. The secretory unit develops in this terminal end piece. Innermost cells form secretory cells and outer cells form the myoepithelial cells or contractile element. As this parenchyma expands, the connective tissue elements diminishes, but still the terminal end piece is surrounded by a tense connective tissue containing blood vessel and nerve. The final disposition is in the form of a capsule and septa that divides the gland into lobes and lobules. The nerve supply is both sympathetic and parasympathetic. Parotid gland develops in 4 to 6 weeks, submandibular in 6 weeks, sublingual and minor salivary gland at 8 to 12 weeks. Capsule develops in the last, hence a misplaced tissue is usually found. Structure of a salivary gland resembles a bunch of grapes, with the grapes being the secretory elements and the stalks being the ductal system. The main duct breaks up into series of smaller ducts called striated ducts, which branch to form intercalated ducts that in turn open up into blind terminal end pieces. Terminal end pieces vary in shape, size and number. Shape varies from simple circular to tubular or to multi-lobed polygons. 3 types of cells are found in the terminal end piece: mucous cells, serous cells and myoepithelial cells. The number and distribution varies with different secretory end piece. The basement membrane is continuous around the terminal end piece and the ducts. The terminal excretory end piece is called asanas. We will now be looking into the components of saliva. Saliva is formed at the secretory end pieces. It consists of 2 components: macromolecular component and fluid component. The fluid component is derived from the blood. Formation of macromolecular components. The cells of the asanas are designed for synthesis and secretion of saliva. Proteins are synthesized in rough endoplasmic reticulum, and then shuttled to Golgi complex, where they are packed into granules and transferred to the cell surface. These granules contact the cell membrane and are released into the external environment by a process of exocytosis. A number of changes occur as the secretory granule reaches the cell membrane, that is fusion of cell membranes and rearrangement of lipid layer, so that surface area is increased. Then natural process of elimination starts. Fluid component formation is an active process, salivary glands being able to secrete their own weight every 15 minutes for up to 4 hours. After stimulation, calcium ion is released from storage site within the endoplasmic reticulum. This free concentration increases to tenfold, and opening up of potassium channels at the present at basolateral surface and chlorine channels which are at the luminal surface. Potassium is released from the cell, but in compensation uptake of sodium and chlorine occurs. Chlorine exits through the channel, at luminal surface, and thus maintains a balance. Sodium couples with water and moves towards lower concentration through osmosis towards the lumen. Thus, according to appropriate stimulation, the water influx into the lumen varies. Salivary glands make saliva. An infection in these glands can make the glands swell and hurt. Call your doctor or seek immediate medical care if you have symptoms of infection, such as increased pain, swelling, warmth, or redness. Red streaks may appear leading from the area or pus draining from the area. The Growing Dentist team is always here to help you, with free online consultation.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.